All right, so welcome everybody to our first talk. It's going to be a series of 3 talks discussing longevity and some of the factors that impact longevity and our overall health and well-being. Quick intro myself. I'm one of the sports chiropractors at Velocity Sports Medicine. My name is Kevin D'Angelo. I got the pleasure of hosting 2 great speakers today, Dr. Caitlin Lank and Jeff Ransom, that we'll introduce shortly. Before we do that, a couple of housekeeping rules. First thing I'm going to do is I'm going to actually hit record so that everybody knows this will be recorded today. We're going to be using it as a future reference. A couple things with the talk. We're aiming to do about 30 to 45 minutes of a structured kind of conversation about a lot of these longevity factors and exercise today. If you have a question that comes up during the presentation, please feel free to use the chat feature. You can type your question in the box, or if you prefer to have a live version and ask your question live, you can just hit the number 1 under your name. And if it's an appropriate timing for both our speakers, I will get that all moderated and you can ask them your question. Otherwise, we will try to get all the questions at the end. We'll have a reserved time for Q&A. So with that said, as a bit of something for us to reflect on through the rest of the presentation, we're going to send out a poll. And these, based on what you answer, these are anonymous. It just gives an idea of like where the audience is at, but also something to reflect on in terms of where our exercise is at before we start the talk and learn some more information about that. So I'm going to set that up now, and I'll give everybody maybe about 10, 15 seconds to answer this. So hopefully everybody sees the poll come up. But the question here is, how many days of exercise do you get per week? And then once your responses are in, we'll publish these. Okay, so a couple more seconds here on the poll. Okay, so everybody can see that there. So we have a good, actually really good, actually. Vast majority of people are somewhere like more than 2 to 3 times a week, which is great. Majority here looks about 4 to 5, which is fantastic. One more poll here as well. This is just something more so to reflect on as the conversation goes on today. But this is what is looking at the main components of your exercise routine. So what are the main ways that you get exercise? So things like cardiovascular training, walking, hiking, running, rowing, cycling, those kinds of things, all the way down to resistance training, weight training, sport activities, so forth.
You can only vote for one, but that's still fine.
Mm-hmm.
Vote the one you do the most.
Okay.
Okay, so I'm going to close this in a few more seconds. Okay, and we should be able to see the results. So once again, a really good mix here. Looks like we have a really good variety of exercise and involvement throughout the week, which is fantastic. So I think this will be, based on what we're speaking about today, a lot of relevant things for those joining us. So with that said, we'll get started here. So I'm going to introduce our 2 speakers today. Jeff Ransom is one of our speakers. He's the president and founder of Velocity Sports Medicine. Jeff holds a Bachelor of Science degree in kinesiology. He's an exercise physiologist from the American Council of Sports Medicine. And he's a sports conditioning specialist certified from the National Strength and Conditioning Association. He's been practicing for 3 decades, helping to develop and work with youth, professional, amateur, and Olympic athletes. And he's had about tons of experience. I mean, 3 decades of experience helping patients reach and often exceed their.
It ages me.
Trying to drop any officials' numbers here in the chat. And we have Dr. Caitlin Lank. She's the president and founder of Benchmark Proactive Health. Dr. Caitlin Lank is the co-founder of Benchmark Proactive Health, which is a health assessment company that helps people understand and measure key metrics about their health and lifestyle that they don't get from a standard physical. She is a doctor of family and emergency medicine and assistant professor at the University of Toronto. For the past 10 years, Caitlin has been treating patients in the ER whose dire conditions often could have been avoided with earlier intervention. She grew frustrated by the system's focus on reactive sick care rather than making higher leverage investments in prevention and proactive healthcare. Caitlin is married and has 3 children named Ben, Lauren, and Nora. She loves hanging and playing sports with her family. So without further ado, to introduce this topic today, this question will go out to Dr. Lank. Before we get started, can you maybe define for us longevity and break down what longevity is and maybe why it's important to consider?
Yeah, definitely. Thank you so much for the introduction. I just want to say it's a privilege to be talking to you guys today. I'm super excited about talking about exercise. It's my favorite topic. To get to Kevin's question, longevity is typically defined as how long you live your life. I like to think about it as how long you live a healthy life, which is also referred to as health span. Practicing in the emergency department, I saw so many people suffering in their last 1 to 2 decades of their life from chronic diseases. And obviously this is not what we want. I think my message is that we have control over our longevity. And I think for the most part, this is something that we earn. So people who come through Benchmark, I like to help them approach this with strategy, because what we do now is going to pay off in the long run. And I also love associating like longevity and aging with opportunity. Like, how can we grow as we age? How can we change? How can we take on new opportunities?
That's amazing. Well, thank you. And before we get back to you, Caitlin, quick question for you, Jeff.
Yep.
Before diving into the details on exercise and its role in longevity, maybe we can define what exercise is. I feel it's a term that's thrown around a lot, and there's a lot of issues of understanding maybe what exercise encompasses.
Sure. Yeah, thanks for the intro. Thanks for everybody for joining in. It's great to do this, and thanks for being a part of our first podcast. And we expect to be many more to come. So first, I want to distinguish the difference between physical activity and exercise, because you're right, Kev. A lot of times they're interchanged, and there is a distinct difference. For example, physical activity is movement that is carried out by the skeletal muscles that requires energy. So in other words, let's say, a couple go for a walk, they walk for an hour. Let's say they do, 3-4K in an hour, and then they go back home. That is an activity. However, exercise is a subset of physical activities that is planned, structured, and repetitive, aimed at improving or maintaining physical fitness or overall health. So to compare the same example, if that couple now says, okay, let's do that same walk, but let's try to do it faster and get it under an hour. And then it becomes a habit. And then they say, okay, let's do this, let's say 4 days a week. Now it's a planned, there's structure, and it's now repetitive. So now that's considered exercise. So there is a distinct difference between the two. So I know the focus here is exercise, but there definitely is a place for activity. I encourage a lot of people when they're starting out, start with activity, and then we put a plan to it, and now it's exercise.
That's great. And maybe a follow-up to that too, just before we get into more of the talk, maybe you could also define the main differences between some things we'll talk about today. So strength and conditioning, resistance training versus your cardiorespiratory fitness.
Okay, well, first, cardiovascular is like it's aerobic fitness, it's also called, and it's how well your heart and lungs can supply oxygen to the working muscles. Whereas resistance training that's aerobic. And resistance training is an anaerobic activity, which increases muscle strength by muscles working against a weight or a force. So, you can still use body weight as resistance. It's something to keep in mind, but just cardiovascular just in general is working the heart and lungs, whereas weight training is applying a force, but it doesn't mean you have to actually use weight.
That's great. I think that really sets us up well for the rest of the talk here. So going back maybe to Dr. Link. So in terms of looking at longevity and exercise, what are some of maybe the more broader specific benefits we get from things like cardiovascular fitness?
Yeah, we can talk about the health benefits. There are clear cardiovascular benefits to cardiorespiratory fitness, which include lowering blood pressure. Lowering blood pressure is really important because it's one of our top 3 cardiovascular risk factors. And blood pressure is very modifiable, and it's modifiable through cardiorespiratory fitness. When people come through the program, I have them do 14 blood pressure measurements. And I think this part of the program is critical for a few reasons. Blood pressure is asymptomatic. You don't know whether you have high blood pressure or not. And like I said, it's one of our top risk factors. And so when we engage in cardiorespiratory fitness, this helps us lower this blood pressure. So that is a really important health benefit. It also helps lower our resting heart rate. And then this type of exercise improves blood flow to the brain, and it preserves our brain volume. And this makes it really important, like an important way of preventing dementia. And then there's also psychological benefits. You know, vigorous exercise, it improves our mood, it improves our focus, makes us happier. This is all through like dopamine and norepinephrine. And honestly, it never ceases to amaze me that I can be in the worst mood. I can go down and do a tough workout and I feel so much better. I also notice like I'm more creative. I solve problems when I'm working out vigorously. And this is all related to increasing your blood flow, increasing the neurotransmitters, and it really works.
That's amazing. I think that's fantastic. So at Benchmark, you guys do a lot of metrics that you take. When people are looking at things like cardiorespiratory fitness and looking at strength measurements, how would one measure their cardiorespiratory fitness? And maybe one of the main tests that you guys may use to do that.
Okay, I love that you asked me this question because this gives me a chance to talk about VO2 max. So VO2 max measures how much oxygen your body can use when you're at peak exertion levels. Okay, so when you're exerting yourself around your max heart rate, we measure how well your body is able to use oxygen. This value is very predictive of someone's overall health and their longevity. It uses every system in your body. So as a physician, it tells me a great deal about somebody's health. It's the gold standard for measuring aerobic capacity. And I think it's one of the most important biomarkers that we keep track of.
And it really is. And I've seen the benefit of that myself going through the program and stuff too. It is a great metric for that stuff as well. And a bit of an eye opener, I think, when you do those things too.
Yeah. And I think like there's some intimidation around this. Like I think of VO2 max, people are like, oh my gosh, like this is going to be so hard. This is such an intimidating test. But you know what, when members do their VO2 max, they feel fantastic after, right? They rise to the challenge. They feel great about getting measured. They get their baseline, and then we're able to, use strategies to improve that.
Which is amazing.
So true, because both Kevin and I, like we talked about it, we were actually nervous about it, and sure, it's a challenge, but I felt great afterwards.
Yeah, the last minute or two is always a bit of a struggle, but yeah, you do feel a lot better after getting through it. And I think it's an important metric. I think the one thing that was an eye opener for me as well doing it is that despite exercising for years and stuff, it's something we do day to day. You don't really have measurables when it comes to that too. So it is it's definitely a great standard to look at. Maybe on that topic.
Sorry to interrupt. I was just going to say one other thing. I use myself as an example. Like in the pandemic, I was only doing yoga, and that was like, a rescue for lots of different reasons. But I wasn't doing any strength training or cardiovascular work. And my VO2 absolutely suffered because of that. And so like with regular training and like really focusing on this, I've been able to improve my VO2 max. So knowing what it is helps you develop strategies to improve it.
That's amazing. So I was going to ask you as a follow-up. So talking about VO2 max and talking about cardiorespiratory fitness, how do these things specifically affect things like longevity? How would you use this to your members? Like, how is this used as a metric to guide them down this pathway?
Yeah, that's a great question. And I actually like to use a case example because I think that this sticks with people a little bit more. So I am going to talk about one of our members that went through the program maybe 8-9 months ago. She was a 69-year-old female, and she had her VO2 tested, which was initially placed her in the bottom 25th percentile. That was for females her age. And this bothered her. And she spent 4 months training to improve her cardiorespiratory fitness. So what she did was she did sprints up the stairs when she was at work. And she also did interval training on the bike. And she took this really seriously. She came back 4 months later. She repeated her VO2 max, and she was in the 65th percentile for females her age. And so this example, I can confidently say that this effort that she put in to improve her VO2 max will absolutely improve her longevity. There is a study that is very well known. It's a study out of JAMA in 2018. And they followed more than 120,000 people. And this was all, studying their cardiorespiratory fitness using VO2 max as a metric. And this study found that if a person goes from the bottom 25th percentile to the 50th percentile, then they're able to reduce their chance of dying from any cause by 50%. So I feel like this is very significant. And then, there's times when we have members go through the program and they're at the 99th percentile for their age and sex. And, guess what? This study showed that there's no upper limit to benefit. So if you're a regular exerciser and you're in that 99th percentile, you can still train to get better. You can still train to improve and lengthen your lifespan and health span.
And that's pretty powerful when we actually look at it as an example too. Apart from looking at it as a metric to look at longevity, you've talked about this a lot with, me through benchmark and personal conversations, but how does this also affect one's quality of life and their daily activities and things like that over time?
Yeah, I think that this is best illustrated using a graph that I originally saw out of one of Dr. Peter Attia's podcasts. It's also in his book called Outlive. I'm just going to ask Nancy if you could pull up the graph. Okay, great. Can everybody see that? Okay. You guys can see it. It's enlarged. We're good.
Yeah. Kevin
and Jen. Okay, so this is a graph that I'm going to spend some time explaining because I think it's really important. So on the x-axis is your age, the y-axis is the VO2 max. And along the right, you can see these lines drawn. These lines are activities that correspond with a certain VO2. Okay, so for example, jogging 6 miles per hour up a steep hill, you need a VO2 of 50. And you can see these activities are listed all the way down on the right side. And then now I want to point your attention to these 3 lines on the graph. So the top line in this dark gray are people in that high fitness category. So they're top 95th percentile. The middle, this black line, is average fitness, people in the 50th percentile, and the bottom is low fitness, 5th percentile. And you can see one common theme with all of these lines is that there's a steep decline when you age. And so I like to use this graph with our members because I like to use it to work backwards. So if I say, at 75, a member wants to be able to briskly climb stairs. So if you can find that on the graph, briskly climbing stairs at the age of 75, you need a VO2 of about 32. Okay, so to work backwards, for example, let's use me as an example. So if I want to be able to do that, for sure, I want to be able to do that at 75. I want to be able to run for a train. I want to be able to chase my grandkids. Then that means that at the age of 40, I need a VO2 of 50. So we need to work now. We need to bank that now in order to be able to do the things that we want to do when we age.
Like, I think this is really powerful too. And I believe, I forget the term he uses, but I know Peter Attia, it's like the, is it the Centurion Decathlon or something like that? So like training for your last decade of life, right? And I think that's really important too. So I don't think people realize this as much. My question to follow up on this would be like, is it too late? So, that's always an intimidating thing. You could look at this graph and be like, okay, well, maybe I'm in my last few decades of life, we'll say, we have to assume. And if we're looking back, like, is it hard to replace that? Is it too late, I guess, for exercise? Would be my question for you.
Yeah, that is an absolute no. It's not too late. Any exercise at any age will improve your overall cardiorespiratory fitness and your overall health. Absolutely. I don't know, Jeff, if you wanted to comment on that too.
Sure, I'd like to add to that. I've had new clients and patients start with me mid-60s and 70, not very active in their lifestyle, and they started with me. And I usually start with a foundation base type of movement patterns, and just with the type of foundation-based workouts that we do, body weight type of resistance, they really noticed a difference in their own daily activities in a relatively short period of time. And it's not just the fact that we've started engaging the muscle, but we've also started engaging their neurological system. And that adapts quite quickly. So for example, when they would go on their walks, they noticed that they could go a little bit further. It was more comfortable. If they had to do yard work at home, they lived in they still had their own homes and stuff. So there was work to be done, and they found it significantly easier, which made them happy because it made the day easier. And they also had less joint pain. So, and they started, late 60s. So it is absolutely never too late. You can get results quite quickly.
And some of the studies like point to specific types of cardiorespiratory fitness to improve VO2 max. So, a lot of this is around high intensity interval training or something called sprint interval training, which can be done at any age. And you can start, if you're not a regular exerciser, you can start doing intervals as easy as, when you're walking outside, you go at a good tick for 30 seconds and then you take 30 seconds off. If you are somebody who exercises regularly, you can get on a bike, a rower, and you can do 1 minute on, 1 minute off. You can do that 10 times. And then if you're looking for a real challenge, then a lot of the studies comment on a workout called the Norwegian workout. And that is when you do 4 minutes targeting 80 to 100% of your max heart rate. If you're not sure what your max heart rate is, then a crude measurement is to use your age minus, or your 220 minus your age. And you can take like 80% of that. And for 4 minutes, you go as hard as you can, you take 3 minutes off and you repeat that 4 times. Those are some examples of things that people can start doing that have been shown in the studies to improve your VO2 max.
That's amazing. And I'm going to jump back to you, Jeff, but before I do that, just a reminder here that Nancy brought up as well. If anybody does have any questions throughout the presentation here, drop them in the chat and we can definitely get them to Caitlin and Jeff. With that said, going back to you, Jeff, we've talked a lot about cardiorespiratory fitness and its impact on longevity and health. What are your opinions on the importance of strength training? So let's say strength and conditioning, resistance training, with respect to overall health and longevity.
Well, I've always felt that muscle is the body's foundation. So like this whole discussion is about exercise and improving longevity, and it's having active functional muscle mass. And the more you have it, the better things can be and the better your lifespan. So for example, building up some muscle, including heart and lung capacity, as you increase your muscle mass, muscle increases bone density. So you become far more resistant to, Caitlin had mentioned, falls and things like that. So it increases your joint stability. By increasing that lean tissue, you increase your metabolic rate. And the advantage with an increased metabolic rate is, you find that you're burning fat faster. You're burning fat at rest. It decreases blood glucose levels, having extra lean tissue. And having that extra stability, it increases coordination and proprioception. So again, you have better balance, you have better coordination, but if you do fall, you've got the stability. I do have, a couple of clients who've experienced some pretty nasty falls. One told me a story that she fell down a flight of stairs, like just, let's say about like 6 steps, wood steps. She was in her early 60s, got up, brushed her stuff off, and couldn't believe that she wasn't hurt. That's because she did, some years of resistance training. She built up that tolerance. The other thing that happens is you increase your immune system, and increasing glutamine increases your immune system with more lean tissue. So, there's so many advantages to the resistance training to increase that lean tissue. It's unbelievable, especially with the fact that you burn fat at rest with lean tissue. So if you don't have that lean tissue, it's much more difficult to burn the body fat.
That's amazing. That's really good. And I'll throw this back to you, Caitlin. Like with benchmark and looking at things specific to the metrics you guys are measuring in terms of longevity, what are some of the important things that you tell your patients with when it comes to maintaining lean muscle mass and skeletal muscle mass?
I actually talk a lot about muscle. So over the past year, I've been retraining to become a proactive preventive healthcare doctor from an emergency room physician. And so I've been doing a lot of learning, obviously, and I cannot believe how much I've learned about muscle. Like muscle, I'm going to take Dr. Gabrielle Lyon's, phrase here is like muscle is the organ of longevity. Jeff mentioned some of the benefits, but in terms of longevity, like low strength and low muscle mass increases your risk of mortality. And the studies show this very clearly. One thing that Jeff mentioned was falls. So muscle mass and muscle strength, they help prevent falls. I saw so many people fall in the emergency department, and falls are the leading cause of accidental deaths in people age 65 and older. And this stat doesn't even include people who die 6 to 12 months after their non-fatal fall. And protecting your muscle and improving your strength helps you prevent falls, but it also helps the severity of the fall. And then the other thing I like to talk about is that low muscle mass and low strength causes a condition called sarcopenia. And this causes a host of physical ailments. But studies show that people with sarcopenia are 6 times more likely to report a low quality of life.
There's actually, Kev, could you show up, can you bring up that image that I have of the sarcopenia? Or Nancy, you guys have that?
There we go.
Okay, so if you can see there, okay, so at the top here, the top left, so that's a 40-year-old triathlete. This is like a cross section of the quadriceps. So you can see the bone there in the middle, the femur, and you'll see all that lean tissue around there, and then a little bit of soft tissue on the edge there. So that's a 40-year-old. And then you'll see here on the right-hand side, that's a 74-year-old sedentary person. And you can clearly see the adipose tissue there, the extra body fat, and the breakdown of that lean tissue. That's what's really dangerous. Okay, so that's where, getting out of a chair is difficult. Walking upstairs is difficult. Everything in your body hurts when this happens. And if you look underneath that 40-year-old, that is a 70-year-old triathlete. Now, again, you don't have to be a triathlete to have this kind of lean tissue. You have to have a good exercise regime 3 days a week and see this tissue. This is a strong 7-year-old with all the benefits of the 40-year-old. The scary thing is the sarcopenia that Caitlin mentioned, that could potentially start as early as 40 years old. So if you're an inactive 35-year-old to 40-year-old, once you hit 40, it starts. So if you're in your 50s and you're not doing some type of resistance training, it has already started, but you can get it all back. But this is, when I first saw this, I found this a really scary image for a lot of people.
Yeah, and you can see the muscle in that 74-year-old sedentary man. Like, that quality of muscle looks like very impaired, and you can see that the fat is embedded in that muscle. And so that affects the way the muscle functions. So I found this image very powerful.
Yeah, it's kind of neat too. It's even like, I can comment from like even the role of the therapist over the years too. Like, I'm fortunate that we're in a community that is pretty active, and seeing patients even as old as, in their 70s and 80s that have come back from getting an MRI image or CT scan. And the comments usually from the physicians over viewing the images are always shocked at how good the muscle mass is. I mean, it's a lot of work to maintain this, but it is really neat to see that it can be maintained over time very well.
And this is also something like we need to think about when, if you are unfortunately like hospitalized, or if you have bed rest or whatever, just being mindful that this happens quickly. And so the more reserve you have, the better.
Absolutely. And then one thing I was going to touch on too, like you both have alluded to it as well, maybe we can dive into it a little deeper. When it comes to like, if we look at skeletal muscle as a very like the organ of longevity, maybe you can speak a little bit on its role with like blood glucose moderation and insulin resistance, and maybe not even on like necessarily like a diabetes perspective, but also how that can affect like cognitive health over time and things like that too.
Yeah, absolutely. So this is, if you take one thing away from this podcast, this is what I want you to take away is that, one of the best benefits of muscle is that it has the ability to lower your blood glucose without the use of insulin. So when I think about this, I think about how many diabetics that I saw in the emergency department that I could have counseled differently. I didn't know this until about a year ago. So I'm going to explain it a little bit because I think that this point is really important. So when we eat food, carbohydrates, our blood glucose goes up. This is normal. And what normally happens is that our pancreas secretes insulin, and that helps our blood glucose to go down. This happens frequently throughout the day. And we don't want higher blood glucose because this is bad. It damages the lining of the blood vessels. Glucose gets stored as fat. It can cause diabetes. But we also don't want frequent spikes of insulin because frequent spikes of insulin causes our cells to get immune to it. And then we become insulin resistant, which can lead to diabetes. And insulin also helps store the glucose as fat. So the fact that we can use muscle as our glucose sink is huge. And so the more muscular tissue that we have, then the bigger the sink is. And when we activate our muscle, this works even faster to lower our blood glucose. So the way I think about this is I think that after I eat, I am going to save my pancreas from secreting insulin, and I'm going to move my muscles instead. So I'm going to move my muscles to help my body lower the blood glucose, and insulin is now my safeguard. So muscle is my first strategy to lower blood glucose, and insulin is my second. And I teach this to members, and members can really see this effect when they wear a continuous glucose monitor, because I have them eat a meal, and then I say, don't exercise after the meal. See how long it takes for your blood glucose to come down. And then I ask them to eat a meal and then to exercise after. And people are shocked that the glucose stays very steady and doesn't spike to the degree that it does when you do not exercise.
That's really interesting. I guess from your experience too already with Benchmark, how do you find the changes are? So when people are watching, like they have their continuous glucose monitor, how long do you find these changes to carry over? So for people to recognize if they're pre-diabetic, maybe they're diabetic, do you usually find this is a quick habit with the aid of the glucose monitor?
I think the glucose monitor helps give people real-time data, right? So it gives them an insight into how their daily habits affect what's happening inside, which is super powerful. It's very powerful, right? They see when they eat something, what is actually happening inside their body in real time. And then they try a bunch of different strategies and we work through that together. And when they see that activity 20 to 30 minutes after they eat keeps their blood glucose steady, then that is a lot of reason for them to continue that habit.
That's amazing. And I wanted to circle back to that. Something came up earlier in the conversation, but looking at how important lean muscle mass is and skeletal muscle mass, how is this best measured? So for those that aren't familiar maybe with your program or how the metrics work in healthcare, like how would you best measure these things over time?
Yeah. So, body composition, like if we're going to say gold standard, that would be an MRI, right? I'm an emerge doc. I can't get MRIs for emergencies. So like that would never be an option. You could also use something like a CT scan, but that would give our body so much radiation, it would never be worth it. So our next best thing is a DEXA scan. And a DEXA scan we can use for a breakdown of your body composition. So it gives us lean mass percentage. It gives us our body fat, visceral adipose tissue, and an estimate of our overall bone mineral density. So we use the DEXA scan to get someone's lean muscular mass. And then we also do strength and power assessments. So we do a grip strength, which is very correlated, highly correlated with longevity. And then we also do a vertical jump, which is an assessment of somebody's lower body power.
It's really cool. And I guess this is maybe a question for you, Jeff, as a spinoff. So as a strength coach, having this data, so if you now have collected this data, looking at, let's say, results of the DEXA scan, look at things like grip strength, what's your opinion in helping like your side of the court in terms of helping improve these factors in patients now in the strength and conditioning environment?
It's always good to have data when you're starting a training program because you want to know that you're moving in the right direction. You always have to have a starting point. So obviously, I mean, if I'm already working with someone, if I get this kind of data, now I've got something to work towards. So if we find out anything, as if the adipose tissue is high or, we need to work on a little bit of the strength or anything like that, or the VO2 max was low, we now have goals that we can set. And there's nothing more motivating than chasing a goal. So now that there's metrics available through Benchmark, there's goals to look at. We can really measure everything, and I can adjust programming, and I can adjust my recommendations according to this data. And it makes it so much easier to get results. It's very difficult to achieve results without data, because then you're going to the gym, you're guessing. You're going by a feeling, but if you don't have the data, it's still guesswork. So working out is hard, so you want to maximize your time.
That makes a lot of sense. And then I guess too, just from my experience having the DEXA scan done. So there's obviously, apart from skeletal muscle mass, maybe you can talk a little bit about bone health and like bone mass density and how maybe that works into somebody's health as well and longevity.
Is that for me or for Jeff?
Yeah, sorry, I should have mentioned that. Yeah, so that would be for you, Caitlin. So
Yeah.
maybe you can talk a little bit about, the other metrics from the actual DEXA scan, and how is that used to
Sure.
predict longevity and looking at somebody's overall health.
Yeah, absolutely. So bone mineral density on the DEXA that we do is an overall bone mineral density. So I say this to every member that comes through. It's not a diagnostic test for osteopenia or osteoporosis that would be getting a look at the specific, specifically at the hip or the lumbar spine, but it gives us a total bone mineral density. So it gives us an idea of somebody's overall bone health. And bone health is something that we can protect. And that is, again, through strength training and really taking care of our muscles and by doing power movements. And the reason why is because strength training and power movements pull the tendons on the bone appropriately and in a healthy way. But what that signals to the body is that the bone needs a little bit of help. And so the body gets phosphorus and calcium and packs on more, it improves the bone density. And that's why strength training and power movements are effective. And then vitamin D and calcium are also critical for maintaining our bone health. And then the DEXA also gives us a body fat percentage and also an estimate of visceral adipose tissue. And visceral adipose tissue is the dangerous type of fat that we want to avoid. And that is the adipose tissue that's around the abdominal organs. And that affects the way organs work, and it can lead to insulin resistance and a host of other medical problems. And so these metrics combined, we take a look at somebody's metabolic health and also their muscular and skeletal health as well. And like the one thing I do say about, and Jeff alluded to this, is we really start to lose our muscle as we age, and this can start happening in our 40s. And we exclusively lose type 2 muscle fibers. So I'm getting a bit technical here, but we have two different types of fibers, type 1 and type 2. And the type 2 muscle fibers we lose if we don't specifically train them. And that's, again, through strength training and power movements. So we can probably all think about somebody who's relatively active. And maybe as they age, their body starts to kind of shrink a little bit. And maybe they're just like only walking and not doing resistance training. And that's the reason why. So strength training, resistance training is critical to maintain these fibers that give us all of these health benefits.
That's great. And maybe Jeff, this is a question I'll bounce back to you. So I guess one thing that I see a lot in the clinic as well, we're kind of like the therapists, we're kind of like the middleman. We're trying to get people back into the exercise stream. And I think the one thing that probably is looked at as maybe not detrimental, but is often confusing is when we're trying to introduce load, and the importance of introducing intensity and introducing progressive overload in a muscle to maintain all these things we've talked about, longevity. So maybe two questions here. One being, for those that are on the call today, how does one measure their intensity? How do we know we're doing enough work over time maybe to try and get these changes, whether it's hypertrophy or the muscle mass? And what are maybe some of the things that you usually find that are maybe some cautions that you'd throw out for people before getting into this?
Measuring intensity with resistance training is actually quite difficult. It's very subjective. It's not as a simple equation that we would do with a cardiovascular. There's measurements we can do with cardiovascular, but with resistance training, it's a little more difficult. I mean, let's say you're starting off with a new program, you've been written up a body weight program, and there's going to be a period of DOMS, delayed onset muscle soreness. So let's say we start off, for example, 2 sets of 12 reps of a body squat. And into the 24 hours to 48 hours, if there is no DOMS, no onset muscle soreness, then you know that your body can handle a little bit more. Then you can go to 3 sets. And again, if there's no pain at all, no soreness, then your body has adapted quite quickly. It can tolerate a little bit more. And it's important to really get to know your body's tolerance level. This is where we get into, it's called the overload principle. In order to improve in resistance training, you have to apply the overload principle. So you have to challenge the muscle for adaptation. your body has to have a chance to adapt to a new level of resistance. So, and you measure that by how you feel the next day. If you can barely walk after a set of squats, the next day or 2 days later, it's too much. There's no need to be that sore. So then you have to scale back. So you have to get to know your body through resistance training. That's the best way I can look at gauging resistance training. I always caution people to start light and build up instead of having to pull back, because pulling back is dangerous. Some of the cautions is if you do not know how movement patterns are applied, you need to get advice, because I have a set of exercises that are my favorite, but they require a lot of training. So you have to be careful of what kind of resistance you're putting onto your joints, because they're not used to it. Even though your large muscle groups might be able to handle a movement, the smaller ones, the stability muscles, can't. So you really have to move forward with caution. I always advise everyone to get advice. And if you're starting with resistance, I always recommend starting off with a foundation based. 3 areas of foundation I always emphasize people working on is your shoulder girdle foundation, like your scap stability, your trunk foundation, anything in the midsection. So front flexors, your back extensions, your obliques, and your pelvic girdle, your hips. That's your foundation. You always want to start with that. Um, that is the foundation of all things moving to squats and deadlifts and the bench press and all the cool stuff people want to get to. But if you don't have that foundation, the joints suffer. So it's important to slowly move forward, getting to know the body.
That's a great answer. And then something too, like I'll bring our attention back to the chat box here. So a question did come up that I think is pretty relevant, going back to the DEXA scan. So someone asked here, are there any comments about osteoarthritis and the best ways to address that given the DEXA scan? So maybe this might be a great question for you, Caitlin, in terms of addressing bone mass density, collecting on the DEXA scan, and maybe just highlighting just the environment with OHIP right now. And then when it comes to like actually getting a Z score or T score, finding out diagnosing osteoarthritis, and then maybe we'll circle back to like actually answering that, like what would one do once they discover they have osteoarthritis or osteopenia?
Mm-hmm. Yeah. So at Benchmark, we use the DEXA for body composition. In order to use the DEXA for a diagnosis of osteopenia or osteoporosis, you need specific views and you need to be a specific type of doctor. You need to be a rheumatologist or you need to be a radiologist. So we don't do DEXA scans for osteopenia or osteoporosis. You would need to get a formal DEXA scan from your family doctor. Screening in Ontario starts at the age of 65 and is usually done for people who have specific risk factors for osteoporosis or osteopenia. I think that this is far too late. I think that, postmenopausal women are at risk of osteoporosis and osteopenia, and we don't start screening, I think, until far too late. But Benchmark is not providing a DEXA scan to screen for that. And then I think the question was around osteoarthritis, and osteoarthritis is not diagnosed on a DEXA scan. That would be an X-ray. And I think in terms of like how you would address osteoarthritis with exercise, I would send that back to Jeff.
Sorry, what was that again?
And I think too, yeah. So like, and maybe like, I'm reading this again here too. So we'll go on the question of like osteoarthritis specifically. So if we're looking at how would that best be addressed in terms of someone who's looking into getting into exercise and maybe suffers from various joint osteoarthritis?
Then I would start with that same foundation program. So it's very simple. I would look at shoulder. We're looking at movement patterns. So I'd want to make sure the shoulder blades we can get them to move. We want to get some motion in the shoulders. We'd want to get some light resistance in the pelvic area, the hips, like glute bridges and things like that. We want to start easy stuff working on the core, the foundation. So it's a full foundation program, nothing heavy, body weight only, and that's where I'd begin, and we would move forward from there.
That's a good answer. And I think from there too, I'll circle back on that question just to make sure we've got it from all angles. So I think another way this may have been interpreted too, like let's say you've had your DEXA scan done and somebody has now osteopenia or osteoporosis. So they actually have low bone mass density. This could be a two-tailed question as well. I'll go to you, Caitlin, first. So on medical management, maybe you can do like a little primer, like what would generally, what would we do for something like that in terms of like finding a diagnosis of osteopenia or more severe osteoporosis?
Yeah, so again, that wouldn't be done at Benchmark. So that would be done at an outside DEXA, like a outside radiology department that can diagnose that. And if you do have osteopenia or osteoporosis, there are medications that can help you build backbone. But in terms of like prevention and proactive health, which is what we spend a lot of time talking about at Benchmark, there's three things that really make a difference with this. And that is your weight training. So your strength training, doing, power movements. So, small jumps. If you're able to do burpees, if you're able to do sprints, that helps with your bone mineral density. And then also making sure that you have adequate vitamin D levels, and then making sure that your diet has an adequate amount of calcium.
If I can add to that, I would still recommend getting the DEXA because you'd want to know where your lean tissue is. How much lean tissue do you have? Because if you find you're suffering or the early stages of whether it be osteoporosis or osteopenia, if you find your lean tissue low, that's also a problem. So we want to get that up. So it's important still to see what kind of measures you have on the other tissue.
Mm-hmm. Absolutely. Yeah. And I think a lot of times people focus, on things like their weight, when really what matters is your body composition, and especially like the distribution of your fat. So whether fat is subcutaneous or visceral really matters for your overall metabolic health. And that's something that we're able to get on the DEXA as well. So those metrics to me really matter, like your lean mass and also the distribution of your body fat, because subcutaneous fat is quite healthy. Our energy uses that. Our body uses that as energy stores. We use it for our hormone production. And then we want to know what our visceral adipose tissue is too, because this can lead to metabolic health issues down the road.
That's amazing. I think you guys have done a really good job answering quite a few questions here today and outlining a lot. I'm looking at the time here just to keep everybody on track. I'd love to be able to open up the floor to questions. So if anybody does have any questions and wants to, so the chat actually saw something come up here. So that's excellent. So just it's great. Just addressing that we already did address a lot of the osteoporosis comments. If there's no questions that I can see here now, I'll leave it open for just a couple seconds. I definitely have a few myself.
I also just wanted to say there's a couple other benefits of muscle. Like Jeff alluded to the benefit of muscle and how it's an integral part of our immune system. So muscle creates something called glutamine, and this is something that creates a white blood cell. And this can lead to supporting our immune system, especially with acute infections. And then the other thing is really interesting is that muscle secretes something called cytokines and myokines, and this regulates your mood and your memory. And muscle is also critical for your bone health and your skeletal health, like we just said.
The other thing I'd add is we're in an era of a lot of mental health issues, and nothing helps mental health like exercise. Nothing.
Absolutely.
Yeah. So if that alone, that's a reason to really get involved.
That's amazing. So one question I think would be relevant for me if we're to just set some takeaways from this talk today. So, and I'll ask both of you. Maybe Jeff, will start with you. What would be one habit or exercise that someone could take away, and or a habit they should be doing every day? In terms of, if you look at this theme of exercise and longevity. That's a tough question, but would there be?
Oh, that's easy for me. Work the large muscles.
Cool.
The large muscle groups. I do sometimes go to a local public gym just as a different training space for me sometimes. And what I see is a lot of people working on isolation movements on smaller muscle groups because they are easier to do. Like a bicep curl is easier than a squat, but they're comfortable with it. But you don't get the same benefits. You have to work the larger muscle groups. So a knee hinge exercise, a hip hinge exercise, the quadriceps, the hamstrings, the glutes, pectoralis, chest muscles, upper back, get the larger muscles working because that has far more benefits than doing the easy exercise that someone's comfortable with. So large muscle groups in the gym, especially if you're short on time, the squats, the deadlifts, the push-ups, the pull exercises, That's my one takeaway. Once you're at that point, once you're past that foundation building point and you want to get to just you want to get into some weightlifting and some real strength building, large muscle groups. That's my one takeaway.
No, and maybe to add to that, just sort of people that aren't familiar with like more compound movements, like what are some of the specific benefits we get from compound movements?
Well, compound movement works many muscle groups at once. So let's say I'll take a deadlift, for example. It works the entire posterior chain. So from your upper back all the way down your legs. So, and your trunk is involved, your hip is involved. There's a lot of areas you can hit with one movement. So that's the advantage of a compound movement.
Amazing. Caitlin, if I threw it back to you, so what would be one, I know you've already kind of talked about like, a big takeaway would be looking at skeletal muscle as an organ and how important it is. Would there be a takeaway that you get to most of your clients and members at Benchmark that often gets talked about quite a bit?
Yeah, my simple takeaway is that, my number one prescription is exercise. Exercise is such a powerful drug, and we can really use this to our advantage. So try to exercise, at least 3 to 4 times a week, doing a combination of cardiorespiratory and strength training. And if you're a new exerciser, even starting to walk, and a goal would be like 7,000 steps a day, has unbelievable benefits for your overall health.
I think that's amazing. I think if I was to even add something too, I think as a therapist, once again, in like the middle of it all, I would say consistency is a huge one. So it's really like the metabolic machine that keeps everything going, so we can maintain muscle mass and protein synthesis. And maybe we'll dive into that in our next talk on nutrition. So once again, like looking at the floor, I don't see any questions here, so I'll be selfish. I'll ask some more questions.
Brenda just made a comment that I thought was really relevant. Brenda was saying that the compound movements have improved her form for running and swimming. And I often hear that. I often hear that from, the members that come through Benchmark who are a little bit more cardio focused, and then they end up doing strength training for 4 to 6 months, and they come back and they say that the strength training really improved their running, that they got better times or improved, their cardio based exercise. So I'm happy you wrote that, Brenda. I think that's a great point.
That's great. One of the main reasons why that happens is running, for example, is a very anterior movement. It's a lot of hip flexion moving forward, and the posterior muscles get neglected with endurance running. So as soon as they start getting into squats and deadlifts, that posterior chain of muscles, the glutes and hamstrings, really get firing, and now they can propel themselves forward faster and easier. So that's fantastic to hear.
Yeah, and going back to, like, I know we did the original poll before the talk, so we have quite a few people here that are exercising, on average more than 2 to 3 times a week, which I think is fantastic, probably more than normal. With that said, so I'll look at this in 2 ways, 2 spectrums. For those that are maybe hearing this talk today and are a novice, like they're a beginner, they haven't done much exercise. What would be some take homes for them? Like, what are the best ways to maybe establish these habits? What should be some things that they can be doing right now to get on that track and improve their longevity? What are some of the most important factors they should address? And maybe we'll start, if you want to go there, Jeff, you can start first.
Yeah, I think both you and Caitlin kind of set that tone. You mentioned consistency, and Caitlin said, look, if you're novice, you just started and you want to create a habit. So Caitlin mentioned, look, start walking, start with the activity level, but make it a consistent habit, and then have that grow from there. That is the one takeaway, because you're right. The number one thing is consistency. So if you start off easy, just the walking, but have a plan, do it X number of days a week, and be consistent with that. Once you've created a habit, then it's easier to go to the next level. It's hard to go to the next level if you're going too difficult, but you want to create a habit first. I think you both mentioned on that. So I'm just putting that together.
And in order to create a habit, there's some tips around that too. One, get a buddy. I think working out with a buddy is so important, and it helps keep you accountable. And also to tack it onto an already well-established habit. So that can just help increase, the chance that you're going to be exercising.
That's great. So if we're looking at people maybe on the other side of the spectrum, so people that are used to exercising, maybe they've been doing this for a few decades now, in terms of longevity, and Caitlin, I'll throw this question back to you first. What would be one of the more important things? So I'm looking at myself, for instance, too. So if I'm doing strength training, I'm doing some cardiorespiratory training, is there more of an important factor? Should I be working on more of my VO2 max over time, for instance? And it's kind of hard. It's like picking the teetering scale, but what would be a priority for you in terms of, like, if I was trying to get into a very active 8th, 9th decade, if I'm lucky enough to get that into those ages, what would be more important for me to work on?
Okay, well, that's tricky because they're both equally as important. I tell all my members that. However, if you're forcing me to choose one, it's going to be strength. It's going to be strength and muscle. Absolutely.
Just really quick, I think that's what I would agree to. I think it's underestimated how important it is, you know, and how many people are probably going to be quicker to go on one end and not strength.
Yeah. And, you know, now when I'm working out, I'm like, I have like this checkpoint in my head. I'm like, okay, why am I not strength training? Like because like my tendency is like, I'd like to go do a HIIT workout or go for a run or go for a swim. And so every time I go work out, I'm like, I really should be strength training. And so that helps me strength train more.
What about you, Jeff? What would be your comments to that?
Yeah, of course. I'm going to say strength training because it's funny. With strength training, you can still help improve your cardiovascular output. So, I mean, Caitlin was witness to my VO2 max test. I don't do a ton of, I'm at a stage of my training where I'm not doing a lot of cardiovascular training, but my VO2 max was still okay. You know, it was okay.
Very, yeah. Mm-hmm.
So it was all right. So, I mean, and that's without spending a lot of time on the running or the bike. So the thing about strength training is you can hit all areas with strength training. If you want to add a cardiovascular component to your strength training, just reduce your rest time, and it gets extremely tiring. So HIIT, high intensity interval training, is the best of both worlds. If you're short on time.
That's amazing. I think those are great answers.
Yeah, and strength training in the studies have shown to improve blood pressure, resting heart rate, and have been shown to improve VO2 max as well. So I totally agree with that.
Amazing. So what I'll do is we're approaching the end of our talk. Thank you guys for all the great answers and the advice today. One last call. I don't know if there are any other questions that are still floating around for either Caitlin or Jeff. Otherwise, I thank you guys very much for your time tonight. That was fantastic. I learned a lot, and I hope everybody else did here too.
Yeah, thanks everybody, and stay tuned for our next topic, which is going to be on nutrition. So it's a lot of opinions on nutrition. So it'll be great to filter that out a bit.
See if we can see if we can make that one under an hour. I think that's going to be
that'll be tough.
Content heavy talk for sure.
Yeah. Thanks everyone.
Bye.
All right, take care, guys.